Next is the gentlewoman from California, Ms. Capps.
Chairman Pallone, thank you for holding this very important hearing. The title of the hearing says it all. Medicaid provides a fundamentally critical role in the lives of people with disabilities and their families. And I'm pleased to see, building on the statements of the ranking member, that this is such a strongly bipartisan hearing and that there are many issues that we agree upon. There are two specifically important issues that I want to address and hope that our witnesses will address as well. The first is the impact of the harmful Bush administration regulations that affect our ability to properly serve the Medicaid population. Particularly, I'm worried about the impact of the regulation regarding school-based health services. This is going to have a terribly negative effect on the students that I used to work with. Mr. Deal made comment about his personal experience with some of this legislation. I want to mention my years of working as a school nurse and the many school districts across this country who have students in them attending classes according to the guidelines of IDEA and the Americans with Disabilities Act in the least restrictive environment. They can only do so because of critical services provided to them by the school district through a special attendance. Without reimbursement for transportation and administrative costs, school districts will have to scramble for ways to provide special needs children with necessary services. As the Children's Health Initiative of Santa Barbara puts it, schools are, for many students and families, the only gateway to health services. Furthermore, schools are an integral part of conducting outreach in order to enroll eligible students for Medicaid services. It's hard to see this directive as anything other than an attempt to shut these children out. We simply cannot allow these regulations to be put into place and take us so many years backwards in the Americans with Disabilities Act. I commend our chairman, Mr. Dingell, for introducing legislation to protect children's health in schools, and I'm co-sponsoring that bill. The other topic I want to address in my opening statement regards the importance of community-based care for Medicaid beneficiaries with disabilities and the role played by direct support professionals who provide that care. There is a crisis in workforce recruitment and retention. At the same time, we're seeing such an important shift to promoting community-based care. We need to be going that direction. We need to work harder to recruit and retain professional staff. Medicaid plays a critical role in providing home and community support. Yet without an available caregiving workforce, many beneficiaries will suffer and are already suffering. Caregivers are so vital to ensuring individuals can live independently, maintain jobs, and participate in community activities. Unfortunately, one of the biggest barriers to recruitment and retention is extremely low wages and compensation provided to people who perform these difficult jobs. And I've been working with my colleague, Congressman Terry, and several national organizations to improve this through legislation. Last year, we introduced H.R. 1279, the Direct Support Professionals Fairness and Security Act. The bill would provide funds to states to enable them to increase the wages of direct support professionals who care for disabled Medicaid beneficiaries. Maintaining a viable caregiving workforce is essential to our growing population of individuals living with disabilities. I look forward to hearing from our witnesses today about these dedicated professionals and the impact of salaries on efforts at recruitment and retention. I yield back.
The gentleman